Vital signs. Oxygen saturation. The videos of SWOT Nurse Notes serve as worded explanations and for demonstration purposes only. These notes are based on the owner of the channel's understanding. The channel's purpose is to assist with studying and to help with adapting to the UK clinical setting. These notes are short and simple for persons to better have a foundation knowledge to build on. This, however, does not serve as a specific guide to the NMC OSCE and CBT exams. Hi everyone. I am Nurse SWOT, the owner of the channel. Today we will be looking on vital signs. To be more specific, oxygen saturation. Let's begin. Measurements of the 5 basic functions can be influenced by a number of factors. These can include age, medications, health conditions, and the environment. It is also used to assess one's general health and monitor treatment effectiveness. Measuring and recording clinical observations and calculating National Early Warning Score 2 can appear in the OSCE exams. You will be expected to correctly record these observations on the NUS 2 chart after the completion of vital signs during the assessment station. There are 5 basic functions that you are expected to assess during the assessment station of the OSCE exam. These include 1. Temperature, 2. Blood pressure, 3. Pulse rate, 4. Respiratory rate, 5. Oxygen saturation. Now, what is oxygen saturation? Well, it is the percentage of oxygen-saturated hemoglobin relative to total hemoglobin in the red blood cells. We should already know that a pulse oximeter is used to measure the oxygen saturation of the blood. Do you know how it works? Well, it uses a sensor with a light-emitting diode, LED. Light wavelengths from the LED are absorbed depending on oxygenated and deoxygenated hemoglobin molecules of the red blood cells. The more hemoglobin is saturated by oxygen, the higher the oxygen saturation. The less hemoglobin is saturated by oxygen, the lower the oxygen saturation. Pulse oximeter is a simple device, and readings should be obtained easily. However, accurate determination of oxygen saturation readings can be affected by conditions that decrease arterial blood flow, such as anemia, peripheral edema, hypotension, vascular disease, hypothermia, etc. Let's look on oxygen saturation readings. Do you remember the normal range? If not, here is a reminder. A normal blood oxygen saturation is between 95 to 100%. For persons with COPD, an acceptable oxygen saturation range is between 88 to 92%. A person with an oxygen saturation 92% or less should be referred for a blood gas assessment, and oxygen therapy will be needed. As healthcare workers, we should know by now that the National Early Warning Score 2 is a system for scoring physiological measurements, and its purpose is to identify acutely ill patients. The National Early Warning Score 2 (NUS 2) chart has 2 different scales for recording oxygen saturation. Scale 1 target oxygen saturation of greater than 96% and is used for most persons. Scale 2 target oxygen saturation of 88 to 92% and is used for patients at risk of hypercapnic respiratory failure. For the OSCE exams, do not place the sensor on the same extremity as an electronic blood pressure cuff. Rationale? Blood flow will be interrupted when the blood pressure cuff inflates, causing an inaccurate reading. Assess capillary refill before placing the pulse oximeter probe on the selected finger. Rationale? Poor capillary refill is an indicator of decreased peripheral perfusion, which can affect readings. If capillary refill is prolonged, select an alternative site. Inspect the fingernails before placement of the pulse oximeter probe. Ensure there are no artificial nails and nails are clean. Why? Opaque coatings decrease light transmission and artificial nails blocks light transmission, affecting SpO2 readings. Remember to document in the appropriate scale for oxygen saturation percentage on the National Early Warning Score 2 chart. It is also required that you state if breathing was on oxygen or room air. You are required to do the vital signs at the assessment station. The assessment station is 20 minutes. After completing each vital signs, always state if the readings are within or not within the normal range. Document readings on the National Early Warning Score 2 chart before the 20 minutes is finished. Based on the NEWS 2 score, please indicate verbally the monitoring frequency hours and if escalation of care will be done. Explain the rationale behind escalating or not escalating care. Remember to write the date, time, your initials, and signature where required. Document correctly on the National Early Warning Score 2 chart. One simple error will be an automatic fail for the assessment station. Remember, if readings or findings are abnormal, you are expected to escalate care. Read charts carefully to ensure you're writing in the correct section. The frequency of monitoring of vital signs for care plans are based on the National Early Warning Score 2 total score. Recheck as often as possible to ensure you have completed charts correctly. Remember, vital signs are a part of the assessment station. You can decide whether to do it before or during the AT assessment, fulfilling the criteria. Remember to manage your time. Now, how do you document the oxygen saturation reading on the NEWS 2 score chart? Well, first, look for the sections that states A plus B, SpO2, scale 1, oxygen saturation percent. Remember, only use the SpO2 scale 2 if the target range is 88 to 92%. Only use scale 2 under the direction of a qualified clinician. For the OSCE exam, this section will not be used. Ensure you do not mistakenly write in this section as you document your reading. Second, based on the SpO2 reading, look for the row and column in which the reading belongs. Note carefully that the readings are set within ranges on the NEWS 2 score chart. Please observe carefully each row. At the end of each row, there may be a score. Score can be from 0 to 3. Now let's use examples. Example 1. Let's say you got a reading of 98% on room air. Where would you write this finding? As seen on the chart in black. You would write it in the section, row, of greater than or equal to 96%. Why? Because 98% exceeded the range of what the chart states. You can either write on the chart using numbers, or you can place a dot in the required section to signify where the reading would fall. Note that at the end of the row where the 98 was written, it obtained a score of 0. The SpO2 reading of 98% was obtained from a person breathing on room air. You also have to state this on the chart. Where would you write this? Look for the section on the chart that states air or oxygen. Write the letter A, as seen on the chart in black below the reading column of the 98 that was previously written. Ensure that you always write in the same column as the previous reading. Example 2, a SpO2 reading of 90% on room air. Where would you write this reading? As seen on the chart in red, you would write this reading in a different column. Why? This is a new reading for the same person. Why should it be written in that row? The row is for SpO2 readings less than or equal to 91%. 90% is less than what the chart states. Please note that at the end of the row where the 90 was written, it obtained a score of 3. Now, was this person breathing on room air? Yes. Where would you write this? As seen on the chart in red. A was written in the same column as the 90. I hope this was clear. A full video will be done on how to complete a NEWS 2 score chart. Please subscribe to channel for post notification. Thanks for watching the channel.